advancements in the field in order to stay relevant. This also comes with huge cost, which ultimately reflects in the bills to the patient. Being a surgeon in India goes hand in hand with challenges which are inherent as well as unique to our country. On one hand, while working in a tertiary care center like ours, we routinely face problems that developing countries have to fathom, such as poor, undernourished patients with advanced diseases and debilitated conditions. On the other hand, is the stark contrast, the corporate healthcare setup where the high and the mighty get treatment. Consequently, the Indian surgeon is constantly juggling between these scenarios. Patient management is hence not essentially the best internationally recognized treatment, rather, it is what is best for the patient as a whole, regarding his or her nutritional status, affordability, compliance, willingness for follow up, and also how far he or she lives from competent medical care. Most of the Indian population prefers to go to the private setup due to lack of a robust public healthcare system in India. The major challenge in this setup, starting from small private hospitals to huge corporate setups, is, I believe, trust. Patient here come with pre-equipped knowledge acquired from Google or the social media and with a preconceived notion. Patients will always be worried of whatever is being advised in terms of diagnostic investigations as well as treatment. Sometimes, even after doing a procedure with utmost care and following every guideline and norms, unforeseeable or inevitable adverse events may occur. One has to be always careful as the patient and their relatives are better aware and more hostile these days, which has led to increased litigations and mock trials against the whole doctor community in general and surgeons in particular. As the stalwarts of surgery often quote that it takes 3 weeks to learn how to operate, 3 years to learn what to operate, and a lifetime to learn what not to operate. To summarize, we can say that surgery is becoming increasingly less traumatic and mutilating, more anatomical and functional, and above all, safer. Nevertheless, we have to face challenges without forgetting that in spite of these major technological advances, clinical care, communication, solidarity, the ethical and humanistic management of our patients are the fundamental pillars for the progress of surgery. The years of clinical exposure sometimes numb our hearts and harden our souls. But let us lubricate it with compassion. Let us treat the patient as a whole, where illness is only a transient episode, and let us never forget that not all diseases can be cured, but all patients can be given care. I would like to finally conclude with the following lines. Yesterday is but a dream, tomorrow is only a vision. Today well lived makes every yesterday a dream of happiness and every tomorrow a vision of hope. Thank you.
Hello. Here not.
Thank you, Dr. Ravi Lohani. Wonderful talk. You have covered most of the areas. Now, I call upon Dr. Shailja Mishra. She is MS Ophthalmology. She is a Georgian 2010 batch. And before calling her, I would just like to add that as her topic is preparing oneself for life as post-treatment, preparing oneself. And as far as this preparation is concerned, what I feel like is, as a student, you should be having 3 qualities, because you are going to acquire knowledge and a skill from the different sources. For that, you should be doing 3 things, and which our Bhagavad Gita says. First chapter 39 show what it says, and the meaning of that. I will be coming on the meaning, not on those words. जितेंद्रिय तत्पर और श्रद्धावान ज्ञान को प्राप्त होता है. Frequently, जितेंद्रिय meaning thereby it is having your control on your senses. कि इस समय मुझको ये करना है. Discipline has to be there inculcated in you. जितेंद्रिय होना है, यानी कि इस समय अगर पढ़ना है तो पढ़ना है, और इस समय अगर जिम जाना है तो जिम जाना है. दोनों important. पिक्चर देखनी है तो देखनी है, लेकिन काम करने के बाद हमारे टीचर बहुत बढ़िया उन्होंने बात की, उसका भी याद है डॉक्टर देसाई साहब बोले डॉक्टर शर्मा चाय पीने का कहने का मतलब यह है अपने काम को परफेक्शन से करिए, तब कर पाएंगे जितेंद्रिय हो। दूसरा क्या होता है तत्पर, तत्पर का मतलब लगातार लगे रहिए, कंटिन्यूअस प्रोसेस है ये। एंड दिस आईएनजी मस्ट बी 5 वर्ड होती है उसमें, उसके अभी उसमें से एक है लाइफ लॉन्ग लर्नर। ये एल का मतलब है लाइफ लॉन्ग लर्नर, तत्पर लगातार कंटिन्यूअस प्रोसेस है। और श्रद्धावान, श्रद्धावान मतलब अपने गुरु के प्रति एक इज्जत एक विश्वास के साथ जो टीचर कहेगा उसको फॉलो करिए। एग्जाम्पल तो कुछ छोटा सा, अगर आपने ये क्वेरी की होती कि साहब ये जो ए को ए क्यों कहते हैं और बी को बी क्यों कहते हैं, या ए को बी क्यों नहीं कहते हैं, बी को ए क्यों नहीं कहते हैं, अगर ये क्वेरी की होती तो इस समय सेंटेंसेस बोलना नहीं आता। तो आपको इनिशियली गुरु को फॉलो करना है, बाद में तो अपने आप गुरु हो जाएंगे, जैसे स्टूडेंट पढ़ेगा गुरु हो जाएंगे, लेकिन इनिशियली फॉलो करिए तो लर्न कर लेंगे। तो जितेंद्रिय, तत्पर और श्रद्धावान, these 3 words I invite Dr. Shailesh Mishra.
Just speak.
Yes. उनका चला दो, उनका चला दो।
प्रोजेक्ट नहीं होगी नेक्स्ट पे चलाना पड़ेगा, प्रोजेक्ट नहीं होगी
पहले फरहान चेक करना जो कि हम जवान है इसको पे डालना था।
Some problem is with the
दूसरा लैपटॉप
Our next speaker is Dr. Anand Gupta. He is doing DM gastroenterology and he is joining 2010 batch. And his topic is challenges of modern medical practice. In this connection, just like to say one thing, that as far as this challenges to the medical practice are concerned, one word comes to my mind, that is IMG, Indian Medical Graduate, which on this medical company says that you must be basically an IMG. After that, MS surgery, MD medicine, MCH, DM, all those things. Reason being one, what comes to my mind is you are an MCH in some neurosurgery, phenomena, remarkable like that. The point is, any patient can come to you, your neighbor can come to you. Doctor साहब कान में दर्द है, डॉक्टर साहब क्या कहेंगे? इसको नहीं आता? You have to refer. You have to refer. Provided you know ये कान का दर्द कार्सिनोमा टंग की वजह से नहीं है, या आप जो करते हैं उसकी वजह से नहीं है, जिसमें स्पेशलिटी क्या हमारी है उसकी वजह से नहीं है, आपको रिफर करना पड़ेगा। मैंने सांस छोड़ रही थी, मरीज को कार्डियोलॉजी वाले ने रेफर कर दिया। पेशेंट इधर उधर कंफ्यूजन में रहा, या इमरजेंसी में मरीज आया तो कितना टाइम उसके पास, सही जगह रेफर करना ये बहुत बड़ी आदत है। इसलिए बेसिकली यू मस्ट लेarn IMG and at the same time you should be a professional. So being thereby you must be doing your MBBS very properly, all of you sitting on the back benches. Must, it is a must. Otherwise आपका पढ़ने जाएगा डॉक्टर को इतना नहीं आता, तो आपकी reputation खराब होगी। With these words, Dr. Ananya Gupta, and the topic is challenges of modern medical practice.
स्पीकर बाहर लेके आओ, ये लगा भर गया ये बराबर।
Is there some problem?
Yes, ma'am. Ma'am, no. खुला नहीं था। बस कुछ बोल दीजिए। आवाज बढ़ा कौन सी बस?
There's some problem that we just fill the gap. That as far as the beginner, I should come back to the IMG, Indian Medical Group. I was just reading, there should be 5 things in an IMG. And the words, how to learn it, how to remember it. Is it?
आवाज सुन रहे थे।
Very good morning to Honorable Vice Chancellor, Sir, respected alumni members, teachers, seniors, teens, juniors, and my dear UG student talent. Today when I am having a topic that preparing oneself for a life as a postgraduate, it becomes a very difficult topic to address because there is no single tip or mantra that can be given by anyone to anybody that how to succeed in life or how to excel in life. But as very aptly said by our Honorable Vice Chancellor, sir, there is always a generation, there is always something a generation has to pass on to another generation. So always the senior has to give some information, whether it is a life lesson or it is an academic lesson or a clinical information that a senior has to pass on to the junior. So today, I'm addressing this topic. I'll be going in a process that when you join MBBS and when you will be joining the PG, what difference will take? So once when you pass the entrance exam, you will be on the top of the world. You will have just passed the exam. Many hardships you would have overcome from some financial constraints and also from some background where education is not so important. You would have excelled and you would have shown your hard work to the society and to the people and also to the world that you are capable of achieving something good. You are capable of doing something, of passing medical entrance and entering this world. Somewhere you will be thinking that, okay, now this is the end, now I have already entered this, I won't have to work anymore or okay, I'm just in a good place. But as soon as this phase will pass, you will understand that how the things will change, how you will change as a person, because you are a medical representative. Now people will look upon you your life. So life as a matter background from your, cousin will always be a competition, also your friends and always be a person who will be around you in your all your journey throughout the whole 5.5 years. So there will be no new friends, there won't be a family, and there will be somebody whom you will see look upon to discuss your problems. There will be people who will pull you back, some people, some friends who will push you forward. All these things will happen, and I think everybody has experienced that. Now you will also decide your field of interest. Somewhat you will be inclined towards something like you would be feeling that medical. I think medicine. I will be better in medicine because surgery I can't do that. And if you are going in a dissection room, first year anatomy, you will understand that okay, I can't dissect, I can't operate, so it's better for me for joining a medicine line rather than a surgical one. And most important is there is a nurturing for future. You will be nurtured for future by your teachers. You will be around the people whom you have seen and whom you have looked forward to becoming like them one day. Your teachers will be your ideal. They will be the people who will, nurture you for your future, who will give soil, water, everything to for which you want to grow in life. Then, perks of being an undergraduate, the best advantages is that you will be in a protective environment. That is not the same with the residency or PG. In PG, you become a more responsible person. In this, you are large number of students, a batch of 150 or 200. You can be, you can be an average student. You can be also a gold medalist. It will not matter that much because you will be in a group of students. There is a large number of people that a teacher has to address, that a clinician has to offer the education. Then, uh, then coming after that, the medical education is over after MBBS. Then you will be thrown into a very important and very useful phase, that is internship. Internship today, most of the time it gets ignored because of the current scenario, because of the changing scenario, how coaching institutes have taken over the internship duration. This has changed, but as I would like to share my experience, I was in a college where there was no residency at that time. So we were the ones that interns that we had to deal the patient, we had to treat the patient, we were in direct contact with the consultants. So I would like to share one incident that when I was posted in the labor room one day that a lady came, she was fully dilated, she was about to deliver. And when we examined the patient, she was a brief presentation. We had never done a brief delivery. Me and my one fellow intern was there. We somehow used our knowledge, we delivered the baby and the mother was safe and the baby was safe. That was the moment we realized that all of education has paid off. Whatever we have studied for 5 years has paid off today because we delivered the baby successfully and the mother was safe. That was one day you will feel that yeah, I'm a clinician and I have to work on this part, and I feel you will feel privileged to be a part of the society where you can offer such service and you can feel happy for the mother, baby, and society as a whole. So the main thing that I have to tell you about internship is it makes you to be prepared for the coming, what you are coming, what you are dealing in the future, in the near future. That is, you are going for most of you will be going for residency.